I'm Dr. Joshua Sabari, a thoracic medical oncologist at NYU Langone Health Perlmutter Cancer Center. As a thoracic medical oncologist, I treat patients who have lung cancer. My particular clinical as well as research interest is in patients with EGFR mutations, which drive their lung cancer. The reason I chose lung cancer as a career is because I was enthralled by the biology of the disease. As a medical student, I was fortunate to be working in a lab studying resistance mechanisms for EGFR mutant lung cancer. I also think about my dad, who was a former smoker, and I'm not sure if that's what drove me to do this as a career, but it's somebody who I think about on a day-to-day basis. Lung cancer is a common diagnosis with over 225,000 patients diagnosed in the United States annually. Lung cancer can occur in people who've smoked or people who have never smoked. EGFR mutations are relatively common. It's really important to identify these alterations early and to act upon them. There's multiple different ways that we can identify them. You can do piecemeal testing by immunohistochemistry. We call this molecular testing. These are specific antigen antibody reactions to EGFR. The quick turnaround time is helpful, but they can often miss a lot of different alterations. More recently, we've been using next generation sequencing. This is a mechanism where we can study the different alterations in the DNA of the cancer. One of the most gratifying things about my work is the relationships that I build with patients, the ability to help people, the ability to study new drugs and to help patients live better and happier lives with their families. I hope to understand different resistance mechanisms, specifically in EGFR mutant lung cancer. This will allow us to develop the next generation inhibitors and therapies for our patients with this difficult to treat disease.